It's a scandal which inflicted disease and death on hundreds of innocent families across Wales, and many are still suffering to this day.
I've lost so many years with my children, where I couldn't go and do the things that a normal mother would do with the children.
And as the High Court grants permission for some patients to sue the government, one whistleblower tells us that experts knew the procedure was risky at the time, but continued to treat patients with contaminated blood anyway.
Factor VIII produced in the UK was available, which we knew was safer, but it was scarce and would often run out.
Could more have been done to prevent the suffering? 4 decades after the contaminated blood scandal began, victims are still searching for answers.
June this year, and it's a big day for 15-year-old Bronwen Crydes and her grandmother Jan Morgan.
Just excited. What a boss.
They're on their way to London, where Bronwen will help deliver a petition to the Prime Minister. It calls for a public inquiry into the contaminated blood scandal. Among the thousands affected was Bronwen's grandfather, David Morgan.
Tad is with us. He is definitely with us in spirit.
Since she was 3 years old, Bronwen has been brought up by her grandparents at their home in Nelson near Caerphilly. David Morgan was a haemophiliac. He contracted hepatitis C after using contaminated blood. He died at the age of 64 in November 2010. Today is a hugely significant day for the family.
Not only did my husband suffer with hepatitis C, and thereby the whole family suffered, he also campaigned to get justice and compensation for people who were infected with this contaminated blood product. Bronwen is carrying on the campaign that my husband was involved in, and he would especially be very, very proud of her.
Haemophiliac's blood does not clot easily. That means when they bleed, they could die, unless they get specialist treatment. At the beginning of the 1970s, haemophiliacs began to receive a new form of treatment. Factor VIII was created using plasma from donated blood. There was not enough blood available in Britain at the time to carry out the new treatment. So the NHS imported blood from the United States. But drugs firms there were buying blood from prisoners and from the homeless. Much of it came from people infected with blood diseases. 4,670 British haemophiliacs were infected with hepatitis C. 1,200 of them were also infected with HIV.
Here in Wales, 280 people were infected. 70 of them have now passed away. Campaigners have accused the UK government of covering up what was known at the time about the risks of using blood plasma imported from the USA.
Jane Jones from Groeslon near Caernarfon has von Willebrand's disease, a type of haemophilia. For the past 36 years, she has also been living with hepatitis C.
Back in 1981, I had a miscarriage. I needed 4 pints of blood and blood products to clot my blood. It was during that time that they were bringing the blood and blood products in from America. So I was contaminated with hepatitis C.
Hep C is known as the silent killer. The virus has no noticeable symptoms until the liver becomes significantly damaged. The damage only began to take its toll on Jane 4 years ago.
It's just unbearable sometimes, especially before I had my transplant. To the point where you couldn't even walk unaided to the bathroom. He was so weak, felt so unwell. I had a problem where my tummy was swollen up to the point where somebody thought I was about to give birth to a baby. I was so big. Not only was it in my tummy, it was also in my lungs as well. So it was slowly drowning my lungs.
Jane's doctors said she had just 2 months to live on Valentine's Day 2014, when she was rushed to hospital in Birmingham for a life-saving liver transplant. Now, every 3 months, she makes a 300-mile round trip to Birmingham to check the Hep C hasn't started attacking her new liver.
Hi, how are you?
How are you?
Good, I'm all right, thanks.
Nice
Good.
to see you again.
Good, come through. That's it. Have a seat. Have a seat. The good news is that your tests have been so good and you're doing so well that we probably don't have to see you except every 6 months in Birmingham.
Oh, that's lovely. Thank you.
Good.
So good news from today's visit to the consultant. But the disease which has blighted most of Jane's adult life could return at any time. She's determined to make the most of life while she can.
I've lost so many years with my children where I couldn't go and do the things that a normal mother would do with the children and with the grandchildren as well. Now that I've had the transplant, I feel so much better. So at least now I'm able to try and make up for lost time.
Jane is not the only member of her family to have had her life scarred by contaminated blood. Her mother, Anona Price, was also infected with Hep C after receiving factor VIII in 1979.
I couldn't believe such a thing, you know, that's it. And I used to ask sometimes, is it safe, you know, the blood? Because I had to have a lot of blood there. Is it all right? Oh, no, it's all right, no. Wasn't, was it? I couldn't believe such a thing, really, there. As it happened to Jane as well, there.
Jan Morgan and her granddaughter Bronwen have arrived in London. They have joined campaigners from across the UK outside the Department of Health's headquarters in Whitehall to demand a full public inquiry into the scandal. Jan and Bronwen are just two of the many people here who have a devastating story to tell.
My father and two uncles and my cousin all infected through their haemophiliac treatment. My father passed away 31 years ago at the age of 37, leaving behind a widow and 5 children. I've lost my uncle to HIV as well. And just recently, my dad's other brother, my other uncle, to hepatitis C. So for our family, we've been burying our dead for the best part of 31 years.
My husband was a co-infected haemophiliac, meaning that he received HIV, hepatitis C. The climate was to be very, very quiet about it. In the 1980s, it was, you know, you just never spoke about it. This was a disease, or it was a condition that was received in contaminated blood products through the National Health Service. Rather than being supportive and helping us, they've been nothing but treated us with utter contempt.
I was 5 years old when I was infected through my haemophilia treatment with HIV and hepatitis. It's extremely important that we put as much pressure on the government as possible. The problem that we've had over the 30 years that this scandal has been going on is that there's been not enough people willing to stand up and speak about their conditions, really, because of the vast amount of stigma that surrounds both of the infections. And so to have as many people as we have here today is a really, really good thing.
There were inquiries into the scandal in 2009 and 2015, but so far no government, Labour or Conservative, has accepted responsibility. Despite this, a number of MPs who represent affected constituents are here to support the protesters.
It's really important we get to the bottom of this and we have full answers. People have suffered for a very, very long time, and we do know now that some things definitely went wrong, definitely weren't done as they might well have been done. And I think it's high time now we had a proper public inquiry to explain exactly what happened.
As the time nears to deliver the petition, the emotion becomes too much for 15-year-old Bronwen.
Move back behind them traffic lights, they were picking up...
Right, sweetheart. Just breathe deeply.
You're in the way.
Campaigners have been fighting for answers for almost 4 decades. Despite the long wait, Jan Morgan is determined the fight will go on in memory of her late husband and thousands like him.
We don't need to know what happened. We know what happened, but we need the public to know, and we need those who are culpable should be accountable as well. So we need that, and that's what I'm hoping today, that they will give us a public inquiry.
Coming up, we'll speak to the family still searching for answers after the death of her father.
People who did know about what was going on have not been called to account.
And we'll try to find out what politicians and the NHS in Wales knew at the time about the dangers of contaminated blood.
There is now a danger that has become a threat to us all. It is a deadly disease and there is no known cure.
In the mid-1980s, a series of ominous adverts warned the public of the dangers of a deadly new disease, acquired immune deficiency syndrome, AIDS.
So protect yourself and read this leaflet when it arrives.
At the same time, Rachel McGuinness was growing up on the Llŷn Peninsula with her brother, mother and her father, Chris Thomas.
He was haemophilia. He had mild haemophilia, so he didn't have to have regular treatment. So it was only if he had a bleed from, a knock or overexertion of some sort. And so he would only have to attend hospital when he had a bleed.
Despite his haemophilia, Chris Thomas was an active man who was passionate about sailing and the outdoors. But in late 1984, shortly after becoming a regular user of Factor 8, he and his young family's world came crashing down when he was told his life was effectively at an end.
When I was 13, Dad was diagnosed as HIV positive. He had contaminated blood products. My brother was 11 and I was 13, so he kept it pretty simple. He didn't want to sort of scare us and say, right, that's the end, And in those days, really, the diagnosis or it wasn't good.
Attitudes towards sufferers would often be hostile, and so the family decided to keep Chris's condition a secret.
The media at the time, and we're talking sort of 20, 25 years ago, was very, very sort of homophobic, and the sort of HIV and AIDS was seen as this sort of gay plague and that sort of thing. It was all built up like that.
By 1990, Chris Thomas's condition had deteriorated. The once active man was now confined to the house. The HIV had developed into AIDS, and the end was near.
If you see somebody who's so strong and so capable, sort of become, very weak and totally reliant on personal care, it's very, very sad.
Chris Thomas died on the 19th of September 1990. He was 46 years old. But there were warnings Factor 8 could be dangerous a year before he was infected. In early 1983, reports surfaced in the United States that some patients who'd received Factor 8 had developed AIDS. On April the 2nd, the Lancet Medical Journal stated that although the links had not been proven, careful surveillance should continue. On the 9th of May that same year, the director of the Centre for Communicable Diseases in England and Wales, Dr. Spence Galbraith, wrote to the Department of Health. In this letter, Dr. Galbraith recommends that American blood products after 1978 should be withdrawn, until the risk of AIDS has been clarified. But despite these warnings, Factor VIII from the other side of the Atlantic was still given to British haemophiliacs. During this period, the UK's leading expert on haemophilia was Professor Arthur Bloom. He worked at Cardiff's University Hospital of Wales. Professor Bloom led the way in researching any potential link between the new illness and Factor VIII. This bust of Arthur Bloom, who died in 1992, is now at the Haemophilia Unit in Cardiff. The centre bears his name in recognition of his work. But following reports from the US about possible links between AIDS and Factor VIII, Bloom wrote to reassure members of the Haemophilia Society. He notes the number of cases in the United States is small and unproven, and that there's no evidence that British blood products are safer. Whilst it would be wrong to be complacent, he says, we should give those experts who are responsible a chance to continually assess the situation. But we've spoken to a doctor who insists Professor Bloom was well aware of the risks from imported Factor VIII. He is a haemophiliac and worked with Bloom during the 1980s. He did not want to appear on camera, but talked anonymously. I asked him if he was aware that Factor VIII from America was dangerous at the time.
Yes, definitely. I remember Arthur Bloom warning me against using Factor VIII. But things aren't as black and white as that. Factor VIII produced in the UK was available, which we knew was safer, but it was scarce and would often run out. That's why we had to use the stuff imported from America.
To understand what politicians in Wales knew at the time, we made a request for any relevant documents to the Welsh Government under the Freedom of Information Act.
We were given access to hundreds of documents held at the Welsh Government's archive in Cardiff. But we found nothing that related to what politicians and civil servants in Wales knew about the potential dangers of using Factor VIII. In a statement, a Welsh Government spokesperson said that very few records relating to blood transfusion in Wales are available. The statement also said that contaminated blood records weren't earmarked for long-term preservation.
Experts had suggested Britain should make its own plasma as early as 1975, but the trade continued well into the 80s. Ken Clarke was Minister of State for Health during the height of the AIDS crisis. Campaigners would like to ask him why self-sufficiency was not made a priority.
I think that perhaps it's time that he was held to account and that, government officials and ministers of the state were asked the questions why policy decisions were made, why monies were reallocated when all of the evidence was pointing towards a self-sufficient blood service.
We asked for an interview with Ken Clarke. In an email, he said he saw no point in doing so. According to the email, he wasn't the minister responsible for day-to-day policy on blood products and has no recollection of any serious involvement with any decisions made on the subject. He also stated that 2 fairly full inquiries have previously been held and that they concluded that it was a lack of medical knowledge that was responsible for the tragedy and that no blame attaches to ministers or officials involved in decision-making on the subject. This July, and the Prime Minister has announced a new public inquiry. Welsh victims and families have gathered in Cardiff Bay to discuss what sort of inquiry they'll be campaigning for. 2 previous inquiries disappointed victims and their families because they didn't have the power to compel witnesses to give evidence. The solicitor who represents the charity Haemophilia Wales hopes for a more effective inquiry this time round.
I think it's very important that there's a power to compel witnesses, even if they're very reluctant witnesses, because one of the issues that's arisen in this case, particularly in recent years, has been the suggestion of a cover-up, of people covering their tracks, of documents being destroyed and even tampered with. So I think the inquiry needs to have some muscle in this case.
The Department of Health has repeatedly stated it is committed to transparency about the scandal and has previously denied maliciously destroying documents. David Morgan passed away in November 2010 after suffering a bleed to the brain. The 64-year-old father and grandfather from Nelson had endured years of illness and painful medical treatment because of Hep C. The government provide ex gratia payments to help support victims of the scandal. However, a post-mortem was not carried out after David Morgan's death, meaning Jan Morgan was initially unable to prove contamination was at the root of her husband's death. It was only through the intervention of Haemophilia Wales, her AM and MP, that she was able to receive financial support.
It was a very humiliating experience, and I will not ever do that again. I don't care how destitute I am, I'll never do it.
Jan and David Morgan were married for 21 years. His widow says he enjoyed good health for only 4 of those years. Jan keeps David's wedding ring close to her at all times as a constant reminder.
I'll wear it until I die. So it's his wedding ring. I'm all right. So yeah, it's his wedding ring, and I feel I'll never take it off.
The government is yet to announce a date for the latest public inquiry into the scandal. Many campaigners are hoping the inquiry will have judicial powers to summon those people involved to give evidence.
People who did know about what was going on have not been called to account. I think that we need to resolve this once and for all.
Jane Jones from Gwynedd was infected with hepatitis C when she was just 21 years old. Her health has improved since her liver transplant, but she knows she will have to live with the disease for the rest of her life.
It's mentioned as the silent killer, and sure enough, that's what it is.
The new inquiry into the contaminated blood scandal has come too late for hundreds infected by these deadly diseases. But for the victims still living with the conditions, and for the relatives of those who have passed away, the hope is it can finally give them the answers they've been waiting decades to hear.